Alright, so before I go in the room, I'm going to make sure the patient has all the equipment needed to suction. I'm going to review the chart for their medical history, previous tolerance of suctioning, and then I'll be ready to go in the room. I will knock and introduce myself. Hi, I'm Kelly Rynder. I'm a respiratory therapy student. I'll let them know that I'm going to suction them. If they seem confused or unfamiliar with the procedure, I can explain it to them. Then I will wash my hands and put on non-sterile gloves so I can begin my assessment. Some examples of indications for suctioning are a sawtooth pattern on the ventilator, or a decrease in minute ventilation, or if I auscultate and hear rhonchi. So we'll say this patient has rhonchi, that's an indication to suction, and I can get ready to begin. I'm going to put the patient in a semi-Fowler's position, and I will make sure to test my equipment by occluding the tubing, and I can adjust the vacuum settings on the wall between -100 to -150 millimeters of mercury. I want to look at the monitor and get a baseline for all their vital sign values to make sure their heart rate doesn't increase too much during the procedure. And then I'm ready to connect and unlock the thumb port. I'm going to hyperoxygenate for 30 seconds, and if it's necessary, I can instill 5 to 10 milliliters of normal saline into their airway while they're inhaling. Then before I begin, I want to let the patient know that this procedure is going to make them cough, and then I'm ready to begin. So I will advance the suction catheter down until I feel resistance. Once I feel resistance, that means I've hit the carina and I retract a little bit, and then I begin to suction intermittently while rotating for doing the procedure in less than 15 seconds. And once I see the black line, I've retracted enough, and so I want to, while I'm doing this, I want to monitor their vital signs, and then I will hyperoxygenate for at least 1 minute. I will auscultate again to make sure I don't need to go back down. Then I'm ready to rinse out the tubing. I will insert the saline into here, and it will go down. I want to make sure to avoid getting it in the patient's airway. And once it's rinsed out, I can lock the thumb port, and I can chart and report to the nurse.